aiming for COVID zero is now a thing of the past. In a Facebook Live Thursday night, Premier Kenney says the restrictions exemption program that was introduced in September is not holding up.
That's why early next week, the COVID Cabinet Committee will approve a plan for the careful lifting of public health measures, beginning with the restriction exemption program. We introduced this proof of vaccination program reluctantly to avoid a catastrophe in our hospitals during the Delta wave in September, when Alberta and Saskatchewan were hit hardest because we had the lowest level of vaccination in Canada.
Kenney says Alberta is in a better place due to higher levels of vaccination and greater immunity from past COVID recoveries. But the plan to end the restrictions exemption program is just the start. Kenney says more removals will occur in the near future.
We will also lay out a simple, phased plan to remove almost all public health restrictions later this month, as long as we see a trend of declining pressure on our hospitals.
During the Facebook Live, Kenney was asked what municipalities will do when the program drops. He says if the province moves ahead with lifting public health measures, but cities implement their own policies, it would be a great concern. In a series of tweets on Friday, Mayor Gondek pushed back, saying after Kenney's comments, she asked him for an urgent virtual meeting with all interested municipalities over the weekend. Gondek disagrees with Kenney's statement that municipalities should oblige by the provincial government's wishes, and that for months, the UCP told them to do what they think is best for their people. In a statement to City News, the City of Calgary says, in part, the city is currently working through multiple scenarios depending on what actions the provincial government decides to take and when, balanced with the decisions in the best interest of our Calgary community. The vaccine passport bylaw will end automatically when the province's restrictions exemption program is ended by the Chief Medical Officer of Health. The face covering bylaw will not be affected.